Dear friends, a very good morning to all of you. As you are aware, in our institute we run a clinic where we discuss the cases of tuberculosis which are difficult to be diagnosed or treated. Today, that is 27th of March 2024, we discussed a case wherein the patient was suffering for more than 3 years and on detailed investigation was found to be having a dual infection with tuberculosis and non-tubercular mycobacteria which are called NTMs. This dual infection is uncommonly reported. However, when the genotypic test and phenotypic test show that either both of them are positive or either of them are positive, then the possibility of dual infection is increased. And it is very essential that we diagnose it early and start the appropriate treatment so that the life can be saved. Now coming to the diagnosis, the diagnosis of NTM is difficult. There are very few laboratories in the country which can reliably perform the diagnosis of NTM in their laboratories. And the next challenge is to speciate them, that which species of NTM it belongs to. And further the next challenge is to perform the drug susceptibility test to these NTMs. So what we suggest is that you should rely a report of NTM for the clinical decision making only from the laboratories which have proven track record or from the reports of national reference laboratories. Now coming to the treatment of NTM depends on which species or which type of NTM we are dealing with and the DST pattern if available. Most of the time we do not have DST pattern as very few laboratories are doing it. In the present case, we diagnose the case as dual infection with TB and Mycobacterium fortuitum. The recommended treatment for Mycobacterium fortuitum is a combination of drugs which include injections of oxetine, injection of imicacine, injection of imipenem, celastatin, fluoroquinolones, erythromycin, doxycycline, etc. And we have to make a regimen of 3-4 drugs out of these drugs. In the present case, when the treatment was given to this patient, he responded clinically as well as radiologically very well within 2-3 months itself. And now, once the treatment has been started and the culture has converted, we need to give treatment for about a year. So, to conclude, what I want to say is that in appropriate clinical situations, as discussed above, we should consider a diagnosis of dual infection so that we can start the appropriate treatment early and can save the life of the patient. And for a detailed discussion of the case summary of this case, you can visit the YouTube channel. This is NITRD TB Institute. You can subscribe the channel for such discussions in future also. Thank you.